Honourable Minister, thank you very much for agreeing to meet with us and to this interview. It's really, really helpful, and we're very appreciative of your time. If we can just start by you introducing yourself, please.
Thank you so much, and very, very good morning, dear Professor Walls. My name is Dr. Sen Samantolal, and I was a plastic surgeon in Bangladesh. I look after the patient. But 3-4 months back, our Honourable Prime Minister phoned me as a minister, and she has given me the charge of health ministry in Bangladesh. Before, I used to look after one thing, like burn, but now I have to look everything in Bangladesh, all the health related. So that's my identity now.
And a really, really big remit. And one of the remits, of course, under health is, particularly human health, is antimicrobial resistance.
For so many people in Bangladesh.
Yes. So what do you think are the challenges with respect to antimicrobial resistance for Bangladesh?
Thank you. You know, after I saw as a minister, the most important challenge with me, this is one of these antimicrobial resistance. In our country, you know, it's a big, huge populated country. What I feel, what I have understood within very short period, that we need the awareness and close monitoring of this use of antibiotic. In our country, anybody goes to the shop, they can buy one antibiotic. They don't need the prescription from a generalized practitioner or registered doctor, which is very, very important. Everybody becomes a doctor. So the DG drug control of our ministry have to be taken a very serious step to control this selling of antibiotic by any means. There should be a particular special rule that it should be sold by the application of the registered doctor. Nobody can buy the antibiotic. This is number one. Another thing is this, the infection. And I used to work in a barn before I patients. Infection is a major cause. And this infection is caused because of this, you know, the overpopulated. We have got a lot of visitors in the hospital and nobody follow the hand hygiene. Nobody wash the hand. And the way we used to keep the patient, we cannot keep this. We have to, suppose it's a 200 hospital, there is a 400 patient. So you can understand the things. So these are the things, and also the proper use of antibiotic. If we make a culture sensitivity or something like that, then these are the things we are working on it, and it's a very hard job, and I believe it will take some time, but we have to be very cautious about this.
So you mentioned two issues there. One was the availability of antibiotics in the community, particularly without prescription. And number two was the quite challenging issues that go on in Bangladesh.
Make the awareness to the people have to be.
Yes.
That is, before I came here, I made an interview in the television. I used to say that please don't take antibiotic in our language. Antibiotic may cause your death. So these are the message I must give to the people. You know, the most of the people in the rural are not educated.
Correct, yes.
And that's why our Honourable Prime Minister had stopped to giving antibiotic from the community clinic. There was antibiotic was available in the community clinic, but she has stopped it.
So so this is great that this has happened. How do you think this can be implemented, you know, in terms of enforcing it, if you like, or policing it?
We have to be very, by the magistracy power, we have to be strict with the law enforcement arrangement to mobilize the patient or to motivate them because of the drug shop. And, you know, Bangladesh is a very big country. So it's very difficult to control it from Dhaka city. Then if we make a arrangement, what I plan, that in every district, if we can set up a regulatory body by civil surgeon and which will consist by the law force arrangement, we call magistrate, and then they will check, they will go to the different shops with a surprise visit. If they find anything, they will cut their registration. We have to be very strong about this point.
Yeah. You mentioned the Bangladeshi hospitals. So in the INEOS Oxford Institute, we work in 4 hospitals
In Bangladesh.
in Bangladesh.
Yeah.
Mymensingh, Khulna, Rangpur and Dhaka. A lot of those hospitals have X number of beds, like about 1,000 beds.
Yeah, that is
There's sometimes 3,000 or 4,000 patients, sometimes in corridors, on the floor and so on. In terms of infection control, it's very difficult.
I do.
How do you think you can tackle that problem? You know, what do you see as perhaps some of the solutions for tackling those issues?
In my opinion, the solution will be decentralization of our treatment. Everybody comes to Dhaka or Mymensingh or Sylhet in the main district. If we can decentralize our treatment like this, that you have got very Upazila health complex, we have got district hospital. If we can improve the treatment facility of those area, Upazila and the district hospital, there will be much less patient come to the Mymensingh, Chittagong, Dhaka or something like that. Then I think we can control this overburden of the patient. We can keep the patient in a scientific way. Because now the patient, if you go to Dhaka Medical College, you cannot walk because patients are lying on the floor.
Exactly, yes.
You have seen it.
Yes.
So we have to work on this. That is what my first, what I feel that after I joined the minister, my message was that I must ensure the treatment facility to the rural area. And if I can improve, I am sure that we can improve the situation of the district or divisional hospital.
Honourable Minister, in Bangladesh we try and provide diagnostic services through the IOI in Dhaka, Mymensingh, Rangpur and Khulna. And this is a public health service that we're trying to help with our Bangladeshi friends to try and provide to patients from low socioeconomic sectors, really importantly. Do you think that the Bangladeshi government can kind of help extend those diagnostic services across other areas in Bangladesh on the basis of what we're trying to do and trying to sort of support, if you like, a national health program, particularly for the diagnosis of sepsis?
Thank you. It's a very important question. And we are also thinking of this and we are working on this, that we have to improve the diagnostic facilities. Because as I told you earlier, that we feel that we must decentralize the treatment. So diagnosis in other than Dhaka or big city, in the district hospital, diagnostics laboratories are not quite enough, quite competent enough with their laboratory instrument or anything. And we are also trying to now develop those diagnostics area like laboratory where the test will be done. In other than Dhaka, maybe in the district town. Definitely we have to improve this.
You mentioned before you had 2 sort of priority themes: over the counter sales of antibiotics, and the second one was overcrowding in Bangladeshi hospitals. Obviously, the way in which we use antibiotics in farming is sort of a real issue, and then that how the resistance may spread into the community and into human populations. Do you think that this is also an issue for Bangladesh about how we use antibiotics in the animal sector?
Yeah, definitely. It says that, and we have already stopped. We have already given some instruction to stop to the veterinary doctors to stop the antibiotic, like like they use the antibiotics to the animals. They don't make any scientific reason or something like that. So our ministry, health ministry, and I had a meeting before I came here with the combination with health ministry and livestock and animal, those deals with them. And we have decided that we'll ask all the veterinary doctors to stop the use of antibiotic without any proper diagnosis or something like that. So definitely we'll work on this.
Okay, so when we speak about antimicrobial resistance, we often talk about One Health, antibiotic use or antibiotic resistance in animals and humans, and also the environment.
Yes, One Health.
One Health. And, with Bangladesh is a country that is prone to flooding and prone to cyclones, etc., and extreme weather patterns. Do you feel, or are you concerned about climate change and how the increased, if you like, extreme weather patterns due to climate change will impact on antimicrobial resistance, particularly for Bangladesh?
Bangladesh is such a place where nowadays the climate changes is happening is very surprising suddenly. I have never heard that the flood in Dubai, the airport has been over flooded by Dubai. And before we came to England, there was very hot in Bangladesh. And this flood, the raining, these are very common in our country. So I think so this climate changes has got an effect on this antimicrobial resistance.
As you know, Honourable Minister, we're coming up to the United Nations General Assembly meeting in September on antimicrobial resistance. And I'm sure that you will be in New York with various ministers from sovereign states. What would you like to see come out of the United Nations meeting, particularly for Bangladesh, if you had to list, say, 3 priorities for Bangladesh?
Our Honourable Prime Minister was also a co-chair of this committee. Yeah, so she is very committed.
Yes.
And I came here only by his special instruction to come to about this AM. So what our suggestion will be in the United Nations, that if we can all the nations work together globally, I think we can reduce this problem in the world. But we have to work all the countries together. That message we will give in the World Assembly, in the United Nations.
So in terms of coming together and working together, but also presumably for Bangladesh and for other low-income countries, that almost means sustainable and extended funding and infrastructure support, because a lot of these countries can't do it on their own. So do you think that one of these would be sort of long-term financial support across the UN or across sovereign states?
I think so, that it's very important, because economical condition of some countries, they cannot afford this thing, what you said. So United Nations can contribute in these regards. And I think our Honourable Prime Minister had some instruction. We didn't have any instruction from her. Definitely she will give us some instruction, which we'll discuss in the United Nations Assembly.
You know that there is the United Nations General Assembly high-level meeting on antimicrobial resistance in New York in September. From the Bangladeshi perspective, if you had to have 3 messages from the United Nations in terms of your priorities on AMR, what would they be? What were the 3 things that you would like to come from that particular meeting?
Thank you. You know that our Honourable Prime Minister, she was the co-chair of this AMR. So what we feel that we can send a message like this, the global commitment from the different countries to help the low-income group countries to tackle this AMR. If all countries come forward and give a financial support to the other countries who are not capable enough, I think it should be like this.
Okay, so number 1 is sort of a bit of a solidarity, but also sort of a commitment on financing. Yeah. One of the issues that we've had, for example, on climate change is that, we've now up to, I think, COP something like 27, 28 or something. And, but it's only recently that we've had sort of the commitment, since I think the Paris Agreement, to sort of take a body of like a caucus of self-interested countries. And we'd like to do the same with antimicrobial resistance. So knowing how committed the Prime Minister is, Prime Minister Hasina is. Do you think that the Bangladeshi government would be part of like a caucus, an interested group that would take antimicrobial resistance, super seriously and be part of this focus group?
Of
Do you
course.
think that this could be
I
possible?
think so. I think so, definitely. Because, I told you earlier that our Honorable Prime Minister is very much committed for this AMR. And so I'm sure that in the next, when there is the United Nations Assembly in September, so our Honorable Prime Minister will go there, and most probably I will also join with her. So there must be some message from her also, and committed to combat this AMR.
So if I can just ask one more question on just following up from what you've said, you mentioned that there would be sort of a kind of global support and presumably things like regulation, but also would that global support also be on things like access to diagnostics, particularly in public health hospitals, but also access on affordable antibiotics where they're needed most in that?
Definitely it will be for the diagnostic and portable vaccine for the antibiotic. Definitely there should be support from the globally.
My final question really is sort of thinking long term ahead. You've got a young population that is very, very well educated in Bangladesh. And so you have this sort of intellectual hub coming through. Do you think that, what do you think the solutions are for those young people to champion antimicrobial resistance? Are there specific courses? And if they're not specific courses, can you see specific courses in Bangladesh on antimicrobial resistance? And that doesn't have to be at the doctor or the nurse's level. That can be also at the basic science level. Do you think there are some gaps in Bangladesh that can be filled in terms of education programs?
Definitely. What I feel that what you are helping us to our young doctors to work into, and I am sure that if you can improve our young doctors like technology transfer or something like that, and train them in the research work, what our doctors are doing here with you in the Oxford. And I am sure that doctors and nurses, if they get this opportunity to work and with the research, and they will be able to go back to Bangladesh and support in this AMR tackle.
Honourable Minister, Dr. Sharon, it's been an absolute delight talking to you. Thank you very much for your time and thank you for your answers. Thank you.
Thank you very much for your support.
Thank you.